ASMR. In tonight's video I'm going to be doing a cranial nerve exam for you. So just sit back, relax, close your eyes and let's begin. So to start off with, I'm going to take your name and your date of birth if possible. And your date of birth, please. And tell me the reason that you've decided to come get a cranial nerve today. Okay. Perfect. Okay, so before we begin, I'm just going to quickly explain what the cranial nerves are. So there's 12 of them in your brain and they each do a different job and they control your senses such as smell, touch, sight, hearing and the movement in your neck and head, so simple things like that. So we're going to be testing all 12 tonight and see how you get on. So before we begin, can I just offer you a water, cup of tea, anything like that? No, you're sure? Okay. Well, if you do change your mind, do not hesitate to ask, my lovely. And I guess without further ado, let's get right into the cranial nerve. So I'm going to start by grabbing my gloves and popping a pair of them on. Perfect. That was all gloved up. These are a little big for me, but unfortunately they're all I've got at the moment. Okay. So we're going to start by testing cranial nerve 1, which is your sense of smell, also known in medical terms as the olfactory test. So I've got my little glass speaker and I am just going to fill it up with some water, which I've got here, and a drop of a scent. Now I usually do this with twist, but I want you to cover one nostril at a time, okay? And tell me if it smells the same, different. Okay, so we're going in with the lavender again. Cover one of your nostrils for me, please, and take a deep breath in through your nose. Does it smell the same? Is it different? Or is there no change at all? It's the same. Yeah, perfect. Okay, and now I'm going to go back in with the peppermint. If you want to cover the same nostril, a different one. Okay. Let me know if it's the same, different, not changed at all. Okay, okay. So you think it's maybe a little weaker smelling, okay. Right. Okay. So far, so good. So let's move on to cranial nerve 2, which is your optic nerve. Now this is your sense of sight. So I'm going to grab my Snellen chart, which is the chart with all the alphabet on it. Grab that here. That one down there. Okay. Now, so I've got my chart here, and we're going to start quite simple. So tell me what you can read here on the top line. Okay, perfect, perfect. And what about here? There's 2 letters here. What do they say? Okay. And this line, it will gradually get harder, but we're starting off easy, okay? D-O-Z, is that what you said? Yes, D-O-Z. Now, we've got another line. L-P-E-D. And this one, it's getting difficult now. What do you think this one is? Yeah, this one. This one. Okay, okay, good. This one. And that one. Okay, okay, yep. And this one is going to be almost near impossible, especially considering I don't have my glasses on. So, what do we see here? Yeah, okay, yeah. It's getting harder, isn't it? Yeah. This one. Okay, okay. And here. Yeah, yeah. And do you think you could attempt this row or not? No, no, that's okay. Don't blame me. So from the top again, we got E, F, for you at all. Okay, so the next test is cranial nerves 3, 4, and 6. Now this is your oculomotor, trochlear, and abducens. Very complicated names, but it is just about light and stuff in your eyes again. Kind of similar to the previous tests, but it's different in a way. We've skipped cranial nerve test 5, as that would be next. Now, firstly we're going to test the pupil constriction when light reacts to it. So I just want you to keep your eyes open and relaxed, and I'm going to come in with my light again, my pen light. So to start with, we'll check both your pupils as they are. Okay, yeah. Is it bright? Do you feel any different? What about this one? Same, different. Okay. Now I want you to cover one eye and I will check the open one. Okay. Right, cover your eye, please. Perfect, thank you. Okay, I'm just going to look in your open eye. Okay. Yep. Looking at different angles. Okay. And can you close that one and cover the opposite one for me, please? Yeah, just like that. Perfect. Is that on? Yeah, that's on. We're just going to look in this eye. Okay. Look into. Perfect. Now, just keep both your eyes open for this test. We're going to do another light test. And we're just going to get you to follow the light with your eyes. Can you follow the light? Is that okay? If it's too bright, you can rest your eyes gently, but follow it as long as you can. Amazing job. Okay, let me just write some notes down again. Okay. This next test is just to see how your eyes are with colour. So just to test they aren't colourblind or as such. So I've got a book here. And I'm just going to have a look through and see how you manage with some of these. Find the right page. Okay. Firstly, can you tell me what you see here? Can you see anything in this page of the book? Okay. Now let's find another page. What about this page? What can you see? Yeah, you can see that. Okay. And what about this page? Anything? I'm doing it a bit further away just to test your eyes. Can you see anything? Okay, you can see the square. Perfect. And across. Well done. Let's find some numbers. Test your eyes with some numbers. Okay. So this one may be a little difficult. Can you make out any numbers at all in this one? Not very clearly. Okay, yeah. That is quite a difficult one, I will say. What about if I give it a bit closer? Okay, you can see 9, 5. Perfect. Okay. Let's do another one. So, this is some items. Can you tell me what you see? closer, okay. Can you see a tree? The outline of a tree. Perfect, okay. And one more just for good measure. This one is kind of extreme difficulty level. So can you tell me if you can see anything in this page at all? Anything. Even closer. No, it's very difficult to see. But if you look very, very closely, you can see a faint 3, 6. Very difficult. Or it could be a 3 or an 8. Even up close, I can't tell what that is. But you succeeded that test with flying colours. Okay, right. So next is cranial nerve test 5, which is the trigeminal test. Now this is your facial sensation and chewing, so like what you can feel and stuff, you know. So, is it okay if I touch your face? Is that okay? Okay. Right, can you close both your eyes? Just relax as much as you can. Perfect. Now, I'm going to take this soft brush here and just stroke your face, and if you can tell me which part of your face I'm touching with the brush. Okay, just a small brush. Right, keep your eyes closed. Can you feel that? Perfect. What about that? Yeah, good, your chin. What about this? Perfect, that's your forehead, yes. And here, on the tip of your nose, perfect. And yes, excellent. Now, I'm going to grab my pen here, obviously closed, and if you can tell me if what I'm touching you with is a sharp, well, not sharp, pointy object or a soft object, okay? So can you tell me if that's pointy or soft on your cheek? It's pointy, yeah. What about this one on your nose? Soft, perfect. What about this one on your chin? Soft or pointy? Soft, perfect. Your nerves and facial sensations seem to be doing really good so far. What about this one up on your forehead? A bit pointy, yeah. And one last one. Can you tell me where that is? Yeah, soft on your cheek, perfect. Well done. I'm just going to take some more notes. next we're going to test your jaw muscles. So I just need you to clench your jaw like this. Just tense it up, and I'm going to touch that if that's okay, just to feel the muscles are in order. Okay, yeah. Okay, go ahead and clench your jaw. Okay, yeah. Clench and tense it, yep. Okay, perfect. Okay, so I'm going to get you to move your jaw from side to side. Okay, yeah. Perfect. Okay. So this next test is Cranial Nerve Test 7, which is your facial expressions and taste. So all I want you to do for this test is simply raise your eyebrows to start with. Okay. Perfect, perfect. And can you smile for me? Good. And can you frown? Just checking all the muscles is working correctly. And close your eyes really tightly and puff out your cheeks, please. Strange test, I know, but perfect, perfect. Now, have you noticed any taste changes in taste, like loss of taste, things tasting funny, anything like that recently? No? Okay, perfect. Right. Cranial nerve 8 is the vestibulocochlear, which is hearing. Again, pronunciation's wrong. Okay. So, to start with, to test your hearing, I'm just going to whisper a bunch of random words into your ear, and if you can tell me what I said, okay? Okay. Cranial nerve, cranial nerve, cranial nerve, cranial nerve. Pumpkin spice, pumpkin spice, pumpkin spice, pumpkin spice. first? No? Okay, perfect. Then just go ahead and swallow. Feel your neck. Okay, perfect. Okay, well, cranial nerve. That brings us to cranial nerve test 10, which is vagus. So that's your voice. Right, so I'm just going to get out my colour blindness book again, and I'm going to pick some fairly easy ones, and I just want you to see what you see. We're just checking your voice. Right, what number do you see here, please? 6. Perfect, okay. Can you tell me which image this is, please? It's a cup. Well done. And one last one for good luck. Let's see if we can find it. Can you tell me which shape this is, please? Yes, that is correct. It is a square. Perfect. Your voice sounds perfect to me. Okay. Now, cranial nerve 11 is the accessory test, which is your shoulder and neck muscles. So I'm going to get you to shrug your shoulders up and down, and I'm just going to push on them if that's okay. Okay, perfect. Right, push up and down. Perfect. Yep. Okay. Now, I want you to look both ways, so start, and I'm going to just check for resistance in your face, so can you look this way, please? Perfect. And then the other way. Okay. Excellent. Now, can you just look up and down as far as you can? So just follow my finger up. Follow my finger down with your head. And the last one is just stick out your tongue. This is cranial nerve 12. Just stick out your tongue and wiggle it side to side for me, please. Perfect. Well, I see absolutely nothing wrong with you whatsoever. Maybe a slight bit of blockage in your nose because one nostril was worse than the other for smelling, but other than that, everything looks amazing. You've passed with flying colours. So thank you for coming for your cranial nerve exam, and we will be sure to see you again soon.